term session, or what's known as an university term, the graveyard session. So just to test how graveyardish we are, give me a P. Give me a H. What does it spell? I didn't hear that. That's that. Physiotherapy, ons is tweetalig, drietalig. We do Molweni, Assalamu alaikum, Lumela, ciao. You know we have some cows? Yeah. Ni hao. Yeah. Goeiemorgen. So please welcome everybody to the physio talk. This is the last physio talk of the day. If you're not catching it now, you can catch it online. So my name is Dr. Kamala Mani. I'm the head of physiotherapy at UCT. And this is our lovely fourth year student, Neil Shai. She will chat to you about the journey. And we're just going to tell you a little bit about what physio is about. We also have some interaction that we'd like to see from you guys. And that is the Mentimeter. And so you can just put up on the slide there. That is the Mentimeter. So you guys can engage with us in terms of telling us, yeah, you thought this wasn't going to be a first session. You have to pass a test. You know, university is nothing except extra assessment. So you test your knowledge. No, I'm just joking. No, I'm not so. Okay, right. Next slide, please. So what will we cover in this session? What are we covering in this session? We're going to cover what physiotherapy is all about. Okay? What career opportunities you're going to have. And there's lots of them. Okay? You came with one mindset, I'm going to be the sports next physiotherapy for the Springboks, the Witsbokke, or the Cobras, you know. That's just one mindset. That's just one field that you can go to. There's lots of career opportunities for you as a physiotherapist. We also need to talk about what makes a good physiotherapist. Okay, it'll be important. And then everybody would want to know, what are the requirements? What gets me in? What gets me my seat, my bum on the chair in 2025 at UCT? Okay, what are the requirements for applying? And then Camille will share her journey as a physiotherapy student. Next slide, please. Okay, so here's the Mentimeter. Take out your phone, take out your library phones, TikTok. I saw so many girls making TikTok videos. I hope you all tag in UCT Health Sciences so we can see all your skills. And the question is, what personal, so slide right on top, there we go. What is the personal characteristics you think a physiotherapist should have? So fingers first, let's see what's the biggest word. Oh, surprise, surprise. The same big word is coming up, patience. So yeah, that one's with the N and the C. So you're going to have a lot of patience because you're going to be dealing with patients with a T. Okay, yeah. So we are seeing, what is the other one? Tenacious, I love that. It's not eating, good. Comprehensive, yes. So comprehensive means a lot of things that you do in physiotherapy. Compassion, I love that because you need to be able to deal with various situations and various types of patients that you're going to see. Really important to have empathy also, okay? Endurance, yes, very important, not just like endurance running, but this is a 4-year degree. If you can't have, this is not a sprint, this is an ultramarathon, okay? We want you to get to year 4, right? In order to do that, you need to pace yourself. You can't burn out in first year, I will. Okay. Kindness, I love that. Kindness, not just for our patients, our clients that you will see, but kindness to yourself, kindness to each other. So that's really excellent. Is there a word that I'm missing there? You have to have grit. I love it. Yeah, sometimes it can get sticky out there. Yeah. Okay, next one. Oh, supporting Man United. Yes, that's a good one. Okay, so what are the areas in physiotherapy? So most people come in and you talk about physiotherapy. The first thing they think, oh, we massage. No, we don't. Tiny bit of massage, but actually the 4 areas, the big areas that we cover in our program are the ones that you see in front of you here. It's cardiopulmonary, so everything to do with the heart. So we do rehabilitation for patients post-cardiac surgery. If they've had heart operations, I've currently got a member that has just completed a double bypass. Hopefully everything's gone okay. Patients that have had lung transplant, patients that have had a stroke. So you may know somebody in your family, a friend that has experienced having a stroke, which means one side of the body has now decreased function and mobility, and that can happen even in young people. And then obviously the component that people are most familiar with is what we call NMS, which is neuromusculoskeletal. So you have headaches, you have shoulder pain, knee pain, you've blown your ACL and you've had an ACL, they've got acronyms a lot down there in this university. ACL, anterior cruciate ligament, it's somewhere here. Yeah. I'm a cardio disability physiotherapist myself, so I'm not really worried about the ACL. But Camille should know. Right. So sports area, one area, and on top of it also we look at pediatrics. So please, when people think about physiotherapy, they often think we fix things. They're halfway right. But we also actually work on education, prevention, okay? And that is injury prevention, disease prevention, a big part of what we actually do. We also look at the rehabilitation of the whole person, okay? Not just the muscle that's broken, but what does that muscle do? That muscle is attached to a person that needs to go to work, that needs to interact with communities, that needs to be able to take their son, daughter, mother to the clinic or to wherever they need to be. Next slide, please. All right. What are the career opportunities? Did you know that you can go to so many of these? Did you know? Who knew you could do all these? Hand up. Okay, you're definitely looking at your application. Stand up again. Okay. All right. So you can work in varied spaces. Okay. You can be a first-line practitioner. What does that mean? It means I can walk into Kanewa's practice next year or the year after when she finishes a ComServe. And I can say, I've been suffering from these headaches for years now. It's driving me insane. Medication is not working. Doctor says I must see a physiotherapist. Okay? Or I can actually just say, I've had this problem. I need to come and speak. There's something that's wrong in my neck, where my muscles, my joints meet. So we can treat a patient without having the referral. Okay? So you can have private practice. You can work within a hospital, whether that hospital is private practice, or if you are working in a government setting, so big hospitals such as Protea Hospital or Khayelitsha Day Hospital, New Somerset Hospital, we send our students to a vast amount of places on the clinical platform, and that includes schools, not just, we actually go to normal schools, so mainstream schools, Protea High, we go to schools in Khayelitsha, we go to schools in Bonteheuwel, we go to, what's it called? DISA primary. And what do we do there? You think, school. What do? We do prevention, we do exercise prescription, we do screening. Are you developing according to your milestones? So, when you're a baby, your mom and your dad are keeping track. Oh, it's 6 months, should be sitting up. Oh no, it's a year. Why are you not walking yet? Can't walk. And we push you up and we make you walk. Yeah. So we look for all those things, right? So we can go to mainstream schools, but we can also go to special schools where there are special needs children. Okay, and assist with the mobility of the child, the physical ability of the child. One area that is growing in South Africa, but is quite big in other countries, is industry and corporate. What do we mean by that? You could be the next physio in charge of Amazon.com that's building their building across the way, and manage their staff complement in terms of exercises, prevention of injury on duty, or treating injuries on duty, or managing problems within the workspace in terms of health related. Okay, then you can be one, which just basically means you can become a lecturer. You can become a teacher. And the story behind that is my father was one of 9 kids, and I think 5 out of the 9 became teachers. When we were growing up, we said, never going to become teachers. Never. Guess what? Glorified teacher. Right. So you can become a lecturer. You can go into research, a very important area. Some people, love being in academia, but they don't want to be doing the teaching in terms of students. They want to be out there looking at what are the things that we need to develop, we need to invest time in to find more information to help our communities and our world in a bigger space. Right, next slide, please. Right, so these are just some of the things that we do. The picture in the top right, kids always get the right and the left. When I say left, then they're showing their right. But top right hand corner, my right, that's when our students and a staff member took a community of elderly patients and they went up for the first time ever to Table Mountain. Okay, so we do a lot of outreach in terms of communities. So it's not just about you going in to learn about the person, but also giving back to the communities. We also go to Vista Nova School, and as you can see there, first physio, first female, Rene Naylor, she has taken the Springboks to 2 World Cups, people. Whoop, whoop. Whoop, whoop. Yes, I think those faults are technically in it. Guys, need to wake up. All right, so physiotherapy plays a big role in lots of areas, career opportunities are vast. We would like all our physiotherapy students obviously to stay here, but your degree at UCT can open up doors, not just locally, nationally, but globally too. Okay, I think that's it. Yeah, last slide before I head over to Keneilwe is that, when you come to deciding on a career, it's not the easiest thing to do. When I was a matriculant, I had no clue what I wanted. Sounds weird, but I didn't want to know. All I knew was that I didn't want to be my sister working 24/7. She's a doctor. I didn't want that. I wanted balance, And I wanted to have social, I wanted to be married, to have kids, I wanted to do all that. And silver. So I did it all. And my father said I could choose between a boyfriend and varsity, and I was very chicken. I said, why can't I have both? Yeah, right. But in order to do that, you must dream, and you must dream big. Okay? And for us in physio, I think dreaming is about being dedicated. You must be dedicated to your study. This is not an easy course, it's 4 years. Okay? It's hard work. We will talk to you about that. But it's so, so rewarding. You need to be resilient because maybe, you're the top predator in your school currently, swimming in that pond, showing your fin. I'm the top. Then you come to varsity. Gosh, fail your first test ever. Yeah. Yes. Get you like a ton of bricks, I tell you. But what you need to be resilient. That's what the R is for. You are never a failure if you try again. Every time you stand up, you are not a failure. You are a champion. You are a winner. Okay? So I want you to all say that. I'm not a failure. I'm a winner. I'm a winner. Okay? So you need to be resilient. You need to learn that now already. You need to be eager in what? Eager to learn new things. Eager to expose yourself to different cultures, opportunities that university life offers you. You might be coming from, I always tell the students, hustle in the market. One day somebody's going to come to eat actually full hustle in the market and going to So my apologies. But you need to be eager because you need to learn new things. It's a new space. Sometimes it can be challenging, but we are here to navigate and help you. You need to be adaptable. Sometimes things don't go your way. Okay? But that's okay. The most important thing is that we need to be adaptable. And a perfect example is today you plan, I'm going to see my patient, going to do this with the patient. You get to the patient, say, I don't want to do physio. Yeah. You want to do physio? Come to me tomorrow. I don't want to do it. Actually, I don't want physio. Full stop. This is not working. Blah, 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 blah. Now what you're going to do? You need to be adaptable. You need to find out why is the patient not wanting to do that. And if today it's just a depressed day because something happened to the patient, that's okay. But you need to adapt. So you really need to be, and you need to be motivated. You need to motivate yourself on those days that it can be a little bit challenging. But more importantly, you must motivate your patient for that end goal of getting better, getting to that goal that they want to get. And so I think that's all that I really need to say. The next slide is about the minimum requirements. And I stress here, a minimum. Say it again. Minimum. Right? Which means we're not aiming for that, guys. Everybody that's in this room, we're not aiming for that. We are aiming for what? About higher, highest. Okay. Right. Those are the minimum requirements that you require to get into the program. And the floor is yours, Keneilwe.
Afternoon, everyone. I almost said morning. My name is Keneilwe, as Dr. Mani mentioned, and I am a final year physiotherapy student. Finally. So it's been a journey. So I'm from a small town in Limpopo called Burgersfort. Not a lot of people know it. I haven't come across many people in Cape Town that have heard of it. But yeah, I grew up in Limpopo, and so I decided to study at UCT because UCT is actually a household name in my family. Two of my older sisters also studied at UCT, so I was introduced to the idea of UCT at a very young age. And then I just needed to figure out what I was going to do here. So then I was introduced to physio in grade 10 because I got the opportunity to actually shadow a physio. So then I was like, oh, this is pretty cool. I like this. I like whatever this is. And so I did my research and I found out UCT actually offers physio. So it just felt like it was all aligning. All that had to happen was I needed to get in. And luckily and thankfully I made it in. And so now I'm in my final year, which is amazing. And I think my experience at UCT, in a word, I would say has been well-rounded. I've been able to not only do physiotherapy and learn about physiotherapy in this degree, but also the university offers so much more outside of the degree. I've had the opportunity to volunteer at the Two Oceans Marathon and the Cape Town Cycle Tour and actually get to work with patients and also be a faculty mentor and get to speak at things like this. So I've had so many opportunities to kind of harness my other skills that aren't necessarily physio-related skills. So it's been a really, really cool experience. And I think one of the most amazing things about physio is you get to practice and actually do the job so early on in the degree. We started doing clinicals or getting exposed to clinicals in second year, and now I'm in fourth year, and most of what we do is clinicals now. I'm mostly just going into block and seeing patients every single day, day in, day out. So it's really cool because you get to kind of see what to expect before you even graduate, and you can already decide, is this for me or not, very early on in the degree as well. So I think that's a very cool opportunity that not a lot of people get to get, because a lot of the time they have to graduate and then find a job and then only see, is this even something that I like or not? So love that about physio. And I think, I mean, like Dr. Mani said, it is hard work. So it's not all easy. There are challenges and you will fail tests here and there. But it's fine. It'll be okay. Just work hard and lean on the department and you'll be fine. There's so much support in this space, and I promise you, it might not feel like it sometimes, but they want to see you do well. They really do want to see you do well, and they're here for you. And so currently I am in my clinical rotations. I just finished my community block this week, and I'll be going into my pediatric block on Monday. So any of the parents that have any tips for how to deal with screaming children, pat me on the shoulder and give me some tips, please. I'm a little worried about that, but I'm also excited. And yeah, I'd just like to leave you guys with, I'm going to be paraphrasing Albus Dumbledore from Harry Potter. So help is always available at UCT to those who want it. So if you ask for help, you will get it. I promise you. I'm speaking as somebody that has been so supported by this, not only just UCT, but by this department and my lecturers and the head of department. We are so supported in this space. So for the parents, if you're scared and you're worried about how your child is going to be feeling, the university is here for them. And there is even more support in first year, honestly. Like the transition is, your hand is held throughout that entire transition. So yeah, good luck to everyone. And I mean, I won't see you next year, but I hope that you guys, that Dr. Mani will see some of you next year. Thank you so much.
I don't think we have any time for questions, but we are still available in the Francis Aim area to answer any questions if you still have any. Thank you so much for your time and attention.